So, hallo liebe Community. Wir sind in New York und ich sage willkommen zu einer ganz speziellen Folge Implatalk. Denn wir sind hier im, ja, wie heißt es? What's the name of the building here?
We're at the RO Building in New York, Midtown.
The RO Building in Midtown, New York. Also, wir wechseln jetzt auf Englisch, weil ich habe einen englischen Gast und er ist kosmetischer Zahnarzt. Also er macht nichts anderes als wirklich Zahnästhetik. Und ja, wenn ihr das Ganze mit Untertiteln hören wollt, schaltet die Untertitel ein bei YouTube. Und ich wünsche euch ganz viel Spaß bei diesem ganz, ganz spannenden Interview. Let's start the interview. I got Mr. Nick Mavrostomos. Is that right?
Yeah, that's right.
Okay, so introduce yourself. What do you do? What do you stand for? And yeah, what's your passion basically?
Yeah, so my name is Dr. Nick Mavrostomos. I'm a cosmetic dentist here in the city. I work at Aesthetic, a very large aesthetic practice here. They have practices in Los Angeles and Dubai as well, so there's a pretty global reach to our practice and our patient pool. I'm super passionate about cosmetic dentistry. It's been a field that I've always been interested in and always pursued. And I've always kind of geared my education, my knowledge, and my training towards being as best as I possibly could to prepare myself for an opportunity like this one, which, you know, was a big opportunity for me. And, you know, I was super excited to join this practice and to be a part of a community where I could really focus all my efforts and energies towards the exact type of work that I love to do. So,
wow, that's really cool. So tell us, Dr. Apa is really famous in the field. He's one of the most world-renowned cosmetic dentists. And how did you get into this? Did you do it in an active way or was it by chance?
It was definitely an active process. I mean, by chance is how I met him. So I basically was introduced to him very early on in my career and my education. So I was actually an undergraduate student. So here in the States, we go to college before dental school. So I was in university at the time and I heard him speak at a big seminar and it was a mind-blowing, you know, I'm sure like many people, the first time they're introduced to his work, it's like, wow, you know, this guy's doing so much work, you know, in so many places. So it was just very inspiring because I always knew that I wanted to do cosmetic dentistry and I really only wanted to focus on it. But I didn't know if that was possible at that time, that early on in my career. I thought, you know, you have to do everything to be able to do cosmetic work. You know, nobody can just, you know, be able to focus only on something so specific. And then I saw him and I was like, wow, you know, this is really cool.
He does it.
He does it, and he does it so well. So it was very inspiring, and that was kind of when the active process began, when I said to myself, you know, this is exactly what I want to do. This suits my interests, this suits my personality. So that's when the active process began. So basically from that point on, you know, I went to NYU Dental School here in Manhattan, which is a very big cosmetically driven program. There's actually an aesthetic honors program at the school.
Wow, so we don't have that in Germany.
Yes,
it's a privilege to have that here.
It's very unique even here in the States. So I think NYU Dental School might be one of the only dental schools in the US that has this program.
For how long have they had it?
They've had it for many years. Okay. But it's only for your last year of dental school. If you get accepted into the program, you're able to focus your fourth year on only doing cosmetic, aesthetic, you know, veneer cases. So I was fortunate that I was able to get experience doing veneers, you know, much earlier than most people really can.
Yeah.
So that was a big part of my growth. And then what we do here in the States, I'm not sure about overseas, but we do residency for a year after dental
school. Yeah, we have to do two
years.
Residency.
Okay, so we do 1 year here. Well, you can do two, but I did one. And I did it at a hospital, which was the Veterans Hospital for the military, retired military people, which was another unique opportunity for me to get experience with cosmetic work that most people really don't get because the government pays for all their dentistry.
Wow.
So cost was not a factor in treatment. So I could do ideal treatment plans. So I had a lot of experience with doing cosmetic work leading up to finishing school, basically in my training, which was hard, but you know, I always put myself in a position to try to get as much experience as possible because I knew that my goal was to do this. Yes.
There are learning years, and after that, there's the performance years, right?
Exactly. And I think what helped me personally the most was that I had a very clear vision of what I wanted to do from early. So I was able to move in the direction of what do I want to do and how do I want to learn without having to kind of navigate, you know, do I like this? Do I like that? Do I want to do that?
You had clarity
from the very beginning. I knew exactly what I wanted to do. So, you know, I moved in that direction right away.
Yeah, that's super strong. And what you mentioned is that you saw a mentor, basically, in Dr. Apa, and you did everything to get proximity to him, probably.
Yeah. I mean, look, it wasn't easy. It wasn't like he called me, hey, you know, you seem great, come, you know.
You need to provide value.
Of course. So, you know, I obviously had to, you know, think of creative ways to connect with him. You know, I invited him to NYU Dental School to speak, actually, and that was one way that I got to know him a little bit. You know, I tried to go and shadow him at his office when I was young, which again wasn't easy to do. He's a busy guy, and you know, lots of people want to show up, but you know, it just became a process where it was a long period of time, but I stayed consistent with what I wanted. I always knew that I wanted to end up there, and you know,
persistency,
a little luck, a little persistence, some hard work, and you know, here we are.
Probably some talent.
Some talent, a little bit.
Yeah, he probably looked at your work because he's not gonna let him.
I'll actually never forget. One of the times when it got a little bit more serious and I'd gotten to know him, you know, he said, bring a portfolio of your work. I want to see what you've done. Yeah. And that's pretty nerve-wracking as a young kid to show, you know, the best in the world at cosmetic dentistry. You know, here's my cosmetic dental work. But I've always had, you know, confidence. I know that I'm learning still. I know that I'm, you know, I'm not him, but I'm getting, you know, my goal is to get that good and to learn from him. And, you know, so it's been a cool journey, you know, it's been fun.
Very inspiring.
I've been enjoying it, I should say, you know.
So yeah, let's talk about a little about cosmetic dentistry.
Yeah.
It's a pretty new profession, basically, because maybe 50 years ago, cosmetic dentistry was probably 10 people in the world did it. And now everybody wants to do it. There's a lot of demand coming on because of the social media and all that, and everybody wants to have perfect teeth. So sometimes you have to be a little ethic about it, because not everybody who wants what they think they want should get it, because it's not good for them. So how do you see that in the macro, basically, the field of cosmetic dentistry in the future, and where do you think the whole thing is going?
Well, yeah, I mean, you make a good point. It has not been around as long as we think it really. I mean, bonding porcelain to enamel, I think that, you know, that research started, I think, in the 70s or the 80s. So it's not that, you know, old of a...
And the materials were really bad.
And the material, right. So I think we're still learning as we go. But I think we've, you know, in my opinion, I think we've reached a point now where the materials that we have and the bonding protocols that we have, I think, are at least predictable enough that we know we're providing a good product that we can usually safely assume, if taken care of properly and in good occlusion and with good hygiene, you know, that can last 15, 20 years if taken care of properly. But yeah, as far as the future, I think the biggest, you know, where cosmetic dentistry now is at a crossroads is digital, you know, versus analog. And that's kind of where I see dentistry moving in towards. You know, it's interesting. Our office, the way we do it, it's a mixture of both.
Yeah, you still do regular impressions, and sometimes you do the digital impressions?
We incorporate digital and analog together. So we still take PVS impressions. We still pack cord. You know, we're taking normal impressions.
We do?
Yeah. But we also have a scanner that will, you know, we'll use the scanning components for things like, you know, after making temporaries, that we want the lab to have a very accurate copy of to make the finals look like that. We'll scan the temporaries and give them a printed model of these are the temps, here are the photos. You know, we want to recreate this in the finals. And then the actual veneers that we're making are still layered by hand with, you know, powder and liquid feldspathic porcelain. So we don't mill a lot of restorations. We'll use the milling for some posterior restoration, some stronger, you know, inlays or some copings, but it's still a very old school approach, which I think is unique about, you know, what we do. It still has a very old school
it's like a good leather shoe, basically, right? Because you can make good shoe with the synthetics and all that, and you can manufacture it in a factory basically.
And then they're all the same.
Yeah, they're all the same, right? It's about individualism, right?
Exactly, and that's really the biggest emphasis that we make. Where we're working right now is that we want every smile to be unique, and it really comes down to the smile design process. Really, that's aesthetic dentistry, right? I mean, anyone can prep a tooth or bond a video. That's not where the creativeness and the art is. The magic happens in design, right? It's in the head. It's with the photos. It's figuring out, what is it that we want to do? How will we get there? And then using your hands. I mean, we use flowable resin to design our temporaries with, and we still have a wax up, but a lot of times we don't use the wax up. A lot of times we will sit there and we'll just layer flowable composite over the teeth, shape them, with the patient in the chair. Yeah. There's no more information you can get that's better than the actual mouth, the actual face.
Basically, it's like startups do it. They do an MVP, you know that? It's a minimum viable product, and then they improve it with feedback.
That's right.
Yeah, and you get feedback instantly from the patient.
That's right.
So what's probably very interesting for the community and for the dentists watching our channel is how much time do you spend for that process? Because people think that the prepping process is the thing that takes the most time. Yeah. But how do you evaluate that?
It's interesting you say that, because we basically have a whole separate appointment, a second appointment just for the temporaries to really make them perfect. So, the patient will come in and we'll prepare them, obviously, and we'll put them in temps. And we always bring them back a day later for a full appointment to see them when they're not numb, they're not on anesthesia anymore. Yeah. They've had a little time to see what they have, to speak a little bit.
Yeah, show that to the family, to friends.
The friends, the girlfriend, whoever. And then we really sit down and we design these temps to be, we want our temps to be basically, this is what you're going to get in a better material and better color that they're happy with and that we're happy with. So we spend a lot of time with the temporary. I mean, that's really the key in cosmetic dentistry, are the temporaries, because...
Do you think that the color of the temporaries is also a key factor? Because when I do veneers, I don't do a lot of veneers because I'm an implantologist, but my co-founder, Mr. Philip Poss, he does a lot of veneers, and it's sometimes really, really important to have them be good with the color, to be fine with the color, because the form and all that, it's important to you. It depends on the patient, but if the color doesn't match, you got a problem.
I think the biggest key with the color and the temporaries is kind of understanding, what certain shades of temporaries are going to translate to. So, for instance, if a patient is in B1 temps, shade B1, and they say, this is great, I love this color. Well, I know in my head that, a 1M1 shade, maybe a warmer OM3 is going to be similar. Yeah. Or vice versa. Sometimes they may be in a B1 and they say, this is too bright. So how do you translate this is too bright to, okay, now what shade? It's hard, but I think you kind of, the key I think with color is really kind of understanding your patient and what they're looking for. Yeah. And using things that are actually tangible to make decisions, such as, if you're doing the top arch of teeth, you look at the bottom arch, you say, do you want them brighter a little bit? Do you want them to match the bottom exactly? So it's kind of using clues and understanding the materials well, because, looking at a shade tab is not predictable, because a shade tab in my mouth or your mouth or someone else's mouth, it looks different because skin tone affects color, the lips, people with big lips and big vestibules, it's going to create a shadow, and the shadow is going to make the tooth darker. So we'll bump up the color. If someone wants OM3, but they have really big and heavy lips, we'll bump them up to 1M2, 1M1, and it'll end up looking like OM3 in the mouth. So color's hard.
Because light is not coming there. And
the light isn't there. And then somebody with a gummy smile who shows everything, you don't want to go too white with them because the light's going to hit everything, and that's going to look even brighter. So
and skin tone is also
skin tone is huge. We just did a case on a girl today who's extremely fair skin. We put her in bleach 1 temporaries. I mean, that's like the lightest. Yeah, I know. It's like whiter than your shirt. But in her mouth and on her face, it's like it looks gray. We're like, we have to go whiter. So it's different for everyone. That's why I don't like shade tabs.
Yeah.
You know, I like shade tabs for prep shades to see, you know, the preparation and to relate what's underneath. But to show a patient a shade tab and say, you know, 1M1 or OM3, it almost is going to confuse them more because they're going to see the tab and say, you know, this looks good. But then in the mouth,
it's totally different. Yeah,
totally
we had the story a lot of times.
So color, I think, really is one of those things where you have to kind of guide the patient and in understanding what is it that they want, and you know better with how the color is going to look on them, and then guiding them because.
Yeah, they have to trust you, but trust has to be earned, you know?
Trust has to be earned. No, it's not easy. And there's cases where sometimes, you know, the case comes back and, you know, it's too bright and you have to redo it. I mean, that stinks. You don't want to do that. But, you know, color stuff, I think it really comes down to just understanding the psychology of the patient. You know, listening when they come in, what is it that they want? You know, do they want a really white, bright smile? Do they want something natural and subtle?
That's the first questions you have to ask.
Those are the first things. Is really, I mean, when we do consultations with patients, we don't really talk a lot. You know, we don't say a lot.
You don't have a questionnaire or anything.
It's really listen, like just listen to the patient. You know.
Do you take notes when?
We take notes.
Yeah.
You know, we write everything down, but really it's like.
I mean, you don't take notes. You probably put it into the computer.
Yeah. But I mean, you're really trying to listen, and I think when you talk too much to them, you miss a lot of things, right?
Yes.
Because we want to tell them, okay, you know, this is how the process works. You know, you're going to be in temps, and we're not going to drill a lot of teeth, blah blah. You know, but really just kind of saying, okay, talk to me. And you'll hear a lot. You know, you'll get clues. I want something very natural. I used to have nicer, whiter teeth, and I drink a lot of coffee. I've stained, but I just want to have something subtle. Or you know, you have someone coming in saying, I want bright, white, beauty. You know, so you kind of listen and you figure out, okay, you know, this is what they're looking for. They want a Hollywood smile, or they want something that no one's going to notice. You know, so it's just listening.
Very important. Yeah.
Yeah.
So let's maybe tackle a second topic. You are big into dental photography.
Yeah.
And maybe we can give the community a couple of tips what they have to basically look at and to make better pictures. So first of all, how did you get into dental photography, and basically what's your setup, and how do you do it in the process when you see a patient?
So I got into dental photography very early on when I was in dental school because I knew how important it was to doing cosmetic dentistry. I mean, you can't do cosmetic dentistry without a camera at this point. I mean, it's not even just about social media or adverts. I mean, that's all very important.
For your internal
But for the lab communication, there's really no way to execute at a high level without communication with the lab.
Yeah.
And the lab needs photos. They need photos of the preps. They need good, you know, preparation shades. They need full face. They need a full set of very high quality photos for them to be able to maximize their talents and for you to get back something that you're happy with. So I started to basically train myself in dental school, and actually one of the associates that I have at Apis Aesthetic, Dr. Andy Jean Myro, she's a very big in dental photography. She trained me, and she actually has a course. You guys should look into it, and the viewers should look at it. It's called Stribe. Stribe Dental, S-T-R-I-B-E.
Okay, we're gonna link that in the show notes. So is it an online course?
It's an online course.
Wow, nice.
It's a digital course.
Okay.
And it's not just on photography, but they have photography specific setup, you know, everything, settings, which I'll go into now as well, gear. And they have a lot of other workshops too. It's really good, and that's how I learned my photography. And it's just practice. I mean, the settings on a camera for dentistry's purposes are not that many. You know, it's not, it seems overwhelming, but it's, you know, your f-stop, your zoom, couple things, it's not much. So
ISO is probably almost the same, right?
It stays the same every time. What do you use? About 100 on the ISO, and I leave it there. I don't touch it.
Okay.
But as far as my setup, so I use a Nikon Z5 body.
Z5, okay.
I use a Z5.
It's a full frame, probably?
It's a full frame. It's a 100 millimeter macro lens.
Okay.
And the flash system, I think, is the most important in photography, right? Which, as you know. So we use a twin flash, dual flash for all our
at the sides, basically.
The sides. That you can
no ring flash because it's creating basically,
The ring flash is good for surgery, right? If you're an oral surgeon and you're doing implants, maybe.
We do a lot of
That's great. You know, you want to get deep in the mouth. You want to see back for us, we want to see detail, you know?
Yeah.
2D, 3D detail, but the ring flash kind of washes it all out, you know? It's too much light.
Yeah.
So if you put a photo, it's interesting. We do a comparison where we take the same photo with a ring flash and one with a twin flash. I wish I had it here, but it's crazy how different the details and the color looks.
Yeah.
So for aesthetic dentistry purposes, a dual flash is key. I use the Nikon R1C1.
R1C1. We're gonna look that too.
Yeah.
You need to send it to us.
I'll send you everything. Sure. But yeah, I mean, if you're just getting started on photography, it can be expensive. The body of the camera is the least important, right? For quality.
Yeah.
The lens and the flash are the two most important. So, a Z5 is a pretty good camera. There's better, but you could also downscale to something much more basic on the body.
Yeah.
But invest in a good lens and a good flash and still take excellent quality photos. So that's the setup. And in terms of, our protocol, we take the same photos for every patient.
So it's basically standardization.
Standardized.
Very important to have your protocol.
It's super important to have a protocol, The AACD, the American Academy of Cosmetic Dentistry, they actually have a catalog with not only just the full, the ideal setup for aesthetic dentistry, but they actually, for each photo, they explain the settings that you should have on your camera too. So that's also how I got started in learning. Now I've kind of tweaked.
The feeling.
Now I kind of tweak.
Yeah.
But as far as getting started, so we have a new patient come in. We always take a full set of photos.
Yeah.
So full face from the side and from the side.
Yeah.
A smile shot from the side and also from the side.
Yeah.
And then intraoral, biting, half open, excursive movement.
Intraoral with mirrors.
Intraoral with retractors first.
Retractors, okay.
Retracted first, bite, half open, from the sides as well. And then something I like to do as well is if I'm gonna, potentially do some lower teeth as well, I wanna see their protrusive movements. So I'll have them stop at an edge to edge here. Working side movements, stop on the guide, see if they have guidance. Those photos are really, you can get a lot of information from the photos, and not just that for the lab, but sometimes I'll go back and look at these photos when I'm treatment planning and I'll see something that I didn't see in the mouth. You see a lot in a photo. So it helps with treatment planning. So we take that full set, and then after we've prepared the teeth, we take preparation shades.
Yeah.
And then we'll take a full set of photos again in the temporaries. So all the same photos that we took before.
So those are like 12?
It usually comes out to about 12 to 16 photos, depending on if we want to take an occlusal shot with a mirror, a couple other different types of photos. But, I'll send you the full list of the photos.
That would be awesome.
That we take.
The community would love it.
Yeah. It's
very good.
And it's really simple because it's the same thing every single time,
Yeah.
It's the same photos with the same settings that you switch.
Maybe we can do a link to one example, basically. It's like a PDF or a JPEG.
Absolutely.
So they can see what you're talking about.
100%. Yeah, and it becomes much more clear when you see what these photos are. Right now it's a little confusing, but I think the photography is really, it can't be stressed enough how important that is. I mean, if there's one thing, if you're a up and coming cosmetic dentist, like that is the thing that you should take from this, because that's the biggest tool you have with your lab, with colleagues, with promoting your work,
of course,
social media.
It's one part.
And patients want to see what you've done. You can do, you can do incredible work, and you have no photos to show.
Yeah.
It's your word, right? I mean, I do great work. Okay, can I see?
It's like an artist who paints a picture and throws away the picture.
The painting, where's the paint? That's it. The patient leaves with their teeth, so we have to have something to be able to show.
Yeah. Also for other patients, for inspiration and all that.
For other patients and for ourselves to learn. I mean, we'll take photos of cases that we did years ago, and we'll compare them, 5 years versus, 2 months afterwards. What changed,
Yeah.
Was the material or the cement that we were using great? Is there recession? Is the color changing? So the photos, the use of the photos is endless. And I just can't see how you could do good work without it. I really don't. But
wow.
Yeah.
That's a statement, I think. So
yeah. I mean, it's hard to imagine how you could get to a result without being lucky without the photos. Maybe you get lucky. Maybe the lab just... they're using their imagination and the teeth look great.
Yeah, no, but success is when luck meets preparation.
That's right.
So if
the more information, the better, right? I mean, and I'm sure with you, it's like placing an implant without a CBCT scan. You know, you're guessing.
Exactly.
Maybe it works out, but that wasn't because you had all the information you needed.
It's all about success quotes. Yeah, I mean, even a clock that doesn't run is right 2 times a day.
That's right. Exactly.
It's about success rates basically, and you never get to 100%, but by using a lot of information, a lot of experience, by talking to people, by talking to patients, by listening what you said, you get close to those 100%, and that should be what we should all aspire as dentists.
Yeah, and we want to just basically limit the guessing, right? I mean, we're never going to be perfect, and there's always going to be room for error and room for assumptions, but if we can limit, you know, how much of what we're doing is blind versus with solid, you know, data, that's the goal. That's the goal. And something unique about our practice is that we have our ceramists in-house.
Yeah.
So that's, I mean, we're spoiled, right? I mean, they're right down the hall. You know, I can say, hey, come and take a look at this. You know, this is the color, this is the shade. You know, this is the case that we're working on. You know, they can lay eyes, but a photo is just as good, right? If you have good quality photos and you're communicating with your ceramist with detail, you know, that's going to allow them, you know, to do their best work too.
Right.
Because they're limited with what you give them.
Right.
You know, if you give them, you know,
nothing
garbage, you're gonna get garbage. You're gonna get garbage back. So you can't just say, "Oh my God, you know, this looks terrible." All right, did you send photos? You know, did they see anything? What did you give them to work with other than an impression?
It's like the foundation. Yeah?
Yes.
You have to have a good foundation so the technicians can build a good house.
100%.
Nick, thank you so much. This interview was really inspiring. I think the whole community gets a lot out of this, a lot of value, and I would love to do a follow-up maybe when you come to Europe.
Yes.
You're invited very warmly to our new clinic or even before that.
Absolutely.
So we're going to have some food together now, and if you have questions, write them down into the commentaries or write us an email or PM us. We're going to answer, and if it's something we can't answer, we're going to hand it to you.
Yes. And message me on Instagram, and I'll answer, you know, any questions.
And follow. What's your Instagram?
My Instagram handle is Dr. DOCTOR Mavro, MAVRO.
We're going to link that too. So thank you for your time. It was a pleasure meeting you.
My pleasure. Welcome to New York.
And thank you. And a lot of success for your future.
Thank you so much. And you as well. And you as well.
Thank you. Thank you. Bye-bye.